So welcome, everyone. This is the Moving Forward Nursing Home Quality Coalition. This is one of our coalition conversations, and we're really excited today because we have a slightly new approach, which we've selected a topic, and we had some people who are interested in presenting on this topic and engaging everybody on this call in a conversation. So I'm going to talk very, very briefly and kick it over to them. So I'm the chair of the Moving Forward Coalition. Very happy to see a lot of people on this call. We've got committee co-chairs and members. We've got national researchers and other leaders. We've got family members and care partners, and lots of people from a very diverse array of backgrounds. So that's one of the things about our coalition that we really strive for. This is about bringing diverse voices together and the power that we have when we come together. Asked to give just a very brief update about the coalition's progress. So many of you know, or you are working on committee action plans. And so each of our 7 committees is working to develop action plans that we will test in year 2 of our initiative, which will be starting sometime around the summer, maybe the early fall. As you know, you all know, we're generously funded by the John A. Hartford Foundation. We've got a lot of conferences. I know Isaac is getting on an airplane after this call, and I'm getting on an airplane tomorrow because we're co-presenting at the AMDA conference, American Medical Directors Association conference. We have a few medical directors on the call here. We'll see you in Tampa, Florida. We're also, a few of us are going to Atlanta, Georgia at the end of the month for the American Society on Aging conference. And then we have additional conferences after that. You're welcome to chat in any conferences you are presenting at or would recommend that we present at for moving forward. We've been able to publish a few articles. We've co-authored a few articles, one in the PPAR from the Gerontological Society, also came out in JAGS, the Journal of the American Geriatric Society, same article. We have a piece coming out in the Director, the Nadana Journal, and other requests, radio shows and podcasts and things like that. So we continue to do outreach. We're doing a lot more outreach to the states. So individual states have said, what can we do here? What can the Moving Forward Coalition help with in our particular state? So, again, lots of outreach to advocates. Some of you are on this call. We've already spoken today, ombudsmen, care partners, et cetera. So with that, I'm very pleased to turn it over to Jennie Chin Hansen, who's going to be our moderator for the session today. Jennie, over to you.
Thanks, Alice. Thank you for the leadership that you have provided us as a collective group, and our deep, deep appreciation, as you noted, to the John A. Hartford Foundation for their care and nurturing and funding of this project, and the type of effort that is really meant to move the ball forward. Well, I'm absolutely honored to be invited to coordinate what I'm sure will be a dynamic conversation amongst the people who have been identified as presenters, but those of you, as Alice has mentioned, who have been part of our, quotes, larger community in different ways, from being a resident to people who are in state and federal policy. I have the privilege of teeing up some topics with 3 individuals whom many of you well know. The ability to have much fuller descriptions, I think, are in the flyer, that electronic flyer that went out, that gives a much more robust piece of background on each individual. But let me just do a headliner for this, and I'll be starting with Bob Blancato, who some of you will recognize as actually being part of the leadership as executive director back in 1995 in the White House Conference on Aging, and who has also participated in 4 or 5, Bob, since then.
4 is enough, I think. Yeah, thanks.
Okay, well, one upcoming, hopefully. And Bob has been in a leadership role in this whole topic area for decades. He also has been very active in the Justice and Aging program, and then currently is the involved with the National Association of Nutrition and Aging Services. And so you can tell Bob has been somebody who's been a leader in the country and anchored certainly in the DC area. Also from the DC area and Boston is Dr. Joanne Lynn, geriatrician and hospice physician, many of whom has written extensively and done work in that field and has produced both concepts and publications of books relative to this whole arena of caring for older, frail, and complex individuals. She has been working at the state and the federal and the regional level, has never given up on this topic. She is one of our firebrands in the field to really speak truth to power, and our ability to have her voice and her background. You'll probably notice that there are materials that link to a blog as well as information. We'll cover that toward the end about what can we do. And then my colleague, Alex Spanko, whom I've had a chance to meet in the more recent years, has a tremendous background. He mentioned his personal, for those of you who caught the earlier conversation, his ability to be aware of this as probably a young teenager with some family background. But he is an articulate and literary leader in terms of writing about nursing homes, and headed a journal for that in terms of both operations and policy. And now he is actually the director of communications for the Center of Innovation, which is the nonprofit parent of both the Greenhouse and the Pioneer Network. So you have before you three incredible individuals with backgrounds that speak to federal work that's going on, as well as regional and local work in some of the areas that you recognize. I know that in the flyer, we really talked about this being about a federal level, but I don't doubt that we will frankly pick up the piece like where do we begin about this? So how can we get the attention of federal leaders at a time like this when we're hearing about the potential desire to destabilize Medicare, let alone long-term care, as well as matters related to income security and Social Security. And then, so how can we capture federal people's attention, policy individuals? And then how can we make this the urgency that it is? Ironically, I've been in this field for over 40 years. And so this has been kind of a simmering, burning platform for a long time for some of us. But how can we take this project that is leveraged now and really bring it to more visible and actionable efforts? And then what can we collectively do as a group, both the formal coalition as well as those of us here on the call and the many people we know that care very deeply about this. So I'm going to start with our former executive director of the White House Conference on Aging. And Bob, what are some of your thoughts of, given where we are today and the fact that we have a formal structure right now through this Moving Forward coalition, but you're in DC. You've been working this issue for probably well over 40, if not closer to longer.
Easy, Jenny.
Hey, we have pride. We're working on anti-ageism here. But
Right.
Bottom line is we'd love to hear your thoughts. The way the format will go as we talk, the ability to have all three people have some comments about the topic. We'll possibly talk amongst each other, but between each speaker. And so the ability to think about what people in the audience here on the Zoom call might have some comments. So we'll give a little bit of a break so that people can have timely questions, and then we'll pull it together with broader questions at the end, and then have quotes and action plan perhaps.
Right.
All right, Bob.
Jenny, thank you very much. First of all, it's an honor to be part of this event. I want to commend Terry Fulmer and the John A. Hartford Foundation for their commitment to the Moving Forward Coalition, and Alice for her leadership. And I join my longtime friend and thought leader, Jennie Chin Hansen, and Joanne. You're right. Joanne has done tremendous work in this way, reviving things that we should have been digging with before. And it's great to be with Alex. Nice to meet you, Alex, and thanks for all that you do. You know, the longevity that I guess that you pointed out of my time in this town says to me, you know, to make this issue essential and appealing, it's not a policy issue alone. You've got to build the political imperative behind this issue, which we failed to do up to now, honestly. Some have tried, some have been fearful of it, not getting involved in politics versus policy. But in my world, there's no good policy without some degree of politics. And you need to drill down to the political constituencies that a long-term care system would benefit. Older adults, boomers, persons with disabilities, women, families, especially family caregivers. And maybe the most important political entity of all, the middle class, who would be most benefiting if you end up with some kind of a long-term thing that gets you away from Medicaid and gets you away from the private pay, that lands in the middle, that covers the large majority of people who are there. I also think you have to build a message that resonates beyond a policy message, one that resonates to the emotions that this issue should generate, and it does. I also think we have to agree on basics. What is the definition of long-term care? What's the term we want to use? Is it long-term care? Is it long-term services and supports, or the ones you use today, long-term supportive care? You know, and we don't have a system today. We can accept that. But what do we have that's leading us to the point that could be a system? What should we keep as we develop further? I also think we need to think about modifying the Congressional Budget Office process of how they score legislation, because we're always going to have a tough sell in this world dealing with long-term care legislation. And then finally, I think we also need to, you know, if you want to talk about a practical policy solution, which we do, you know, think about the future savings that are involved if you put a long-term care system together. The savings will be profound, and that is practical policy. So those are some of my thoughts that thing, and you have to focus this on the future. Elected officials have a responsibility to deal with future issues now. So to get to them, you need to raise the issue before they get elected. Get on the campaign trail, raise the issues then. And also the last point I'll make is, you know, we lose track of the fact that money and politics go together. We know that, we don't like it, but it's true. We should be cultivating relationship with major donors, to political people, to elected officials, to parties, to get them interested in this issue and have them bring the topic to this table in a different way. So I'll leave with that thought, Jenny.
Thanks, Bob, for speaking about the practical context that we have, that it's good policy, but the point is also we have to have good politics. And so our ability to do both is crucial. And your point about narrative, how important that story is. I wouldn't doubt that most elected officials, frankly, have had some experience with loved ones in their background, and have experienced, if not in a lightweight way, but if not a significant way, as to what this means. Alex and Joanne, do you have any comment on Bob's entry here?
Sure. I can jump in. And first of all, thank you again, everyone, for having me here. I feel definitely like I'm the newbie in the room with all the great experience and all the big names in this group. So thank you so much for having me. It's a real pleasure. I jumped in there because I wanted to talk a little bit about narrative, because I think someone, as quick background, I ran Skilled Nursing News for about 4 years, learned a ton about sort of the operations and finance side of long-term care and regulatory. But I also learned a lot about how these issues are discussed in the media, because that was part of my job, was following national news stories, local news stories about nursing home care as well. And I think one of the narrative problems we have is that we don't have both a short and a long-term vision for reform in sort of the way that nursing home issues are presented in the media. I say this a lot, but I think if you read any major news story about nursing home reform, it usually frames the issue as funding versus fines, right? So usually the industry will say, we just need more money, we're underfunded, we need more money, and then everything will be fine, but don't ask us too many more questions. And then some of the resident advocates will say things like, well, we just need to be able to fine these homes more, we need to punish them for the harm that happens, and we need to make it easier to sue them. And those are kind of the two broad, nursing home reform is kind of discussed as though it's a binary between those two options. We can pick A or B, and it's clearly not. It's all of the above. There's so many systemic issues, but I think we really conflate. The more I think about this, the more I think of that as really being a discussion of short-term fixes. You know, we're talking about how do we fix life right now for people who are living in nursing homes. So I totally understand if you come from an advocacy background and you've seen some of the, really terrible things that can happen, or even just sort of the more mundane bad things that happen in nursing homes, not necessarily terrible stories, but, just the general lack of autonomy and quality of life. I can understand why you're trying to look at how can we make things better for the people who live in nursing homes now. But I think we also need to really start establishing a narrative of what do we want the nursing home and long-term care, subservices, supports, whatever you want to call it, what do we want that to look like? Because my mantra is, when my wife and I are old enough to require care, I don't want to move into, or I don't want to move her into, the most technically compliant 2-bed nursing home room in the United States at that time. I don't think that's what anyone here really wants. So I think in terms of narrative, I think we have a responsibility to talk about it in both the short-term fixes, right? Because I totally understand. We want to make sure that there are a million people living in nursing homes right now. They deserve to have all of their rights, all of their freedoms, everything that they are entitled to. But we need to start looking past reform and really start to think, how are we going to build the services and supports of the future? Because that's going to require a lot of investment. You can't find your way into a better system than what we currently have. You can only find your way into a better regulated version of our current system, which I think all of us can agree we can do better than. So if I had one narrative thing to talk about, it's I think we need to be able to talk about short-term fix, long-term groundwork.
Thanks, Alex, for building on Bob's comments. Joanne, I'll turn to you for a reaction, and then perhaps you can actually continue on with your commentary on this. So why don't we start with your reflection on Bob's comment?
Well, I agree with what Bob said, and also with what Alex had said. I mean, these are all very good and very substantial leverage ideas. I think that the thing that we're missing and that we all need to pay attention to, everyone here and all of your friends, we have to figure out how to make it impossible for our leadership to keep kicking the can down the road. I mean, look at the enormous fail of the midterm elections. Was there any mention of long-term care? Did you find it anywhere? Was it on anyone's website as to their policy positions? No. We allowed them to think that they were debating immigration, maybe some climate change, and abortion. I mean, those are important things. I agree. But there's room there for us to push this onto the table. As Bob was saying, we really need to build a political imperative. We can't let our politicians get away once again with ignoring this for another round. It has to become something that will be penalized if they don't take it up, and something that they'll be supported if they do. And they'll make some mistakes. Let them make some mistakes. Making mistakes is a whole lot better than doing nothing. And that is what we're doing. Biden came out with some nice proposals early in his term. They all got squelched. And were there protests? Did we raise holy hell in the ballot box? No, we allowed it to slide. So more than anything else, we need to develop a voice that demands that our leadership start dealing with what's coming. Otherwise, we face the middle class being largely homeless within a dozen years. if we are a country that is willing to turn our back on homeless people in their 80s and 90s living with disabilities, then we will have widespread suicides and medical aid and dying. That is not the future I want. That's not the future you want. We only have about a dozen years to get our act together. These things ought to have been done in 1980. You know, we saw all those kiddies trundling off to elementary school in the 60s. You know, we knew they were all going to grow old. We didn't know they were going to grow this old, but we are going to grow that old. So we really must, no matter what else you have as your agenda, no matter if you're working on workforce, no matter if you're working on small homes, no matter if you're working on transportation or housing, they're all terribly important, and they all fail unless our leadership starts recognizing that they need to fund the system and they need to have a vision. We all need to have a vision of exactly where we're headed with long-term services and supports in old age. Elder care is terribly important. We could live out our lives with meaningfulness and comfort, but we won't if we allow this system to keep going forward. When I started working in nursing homes in 1978, there were whole states in which the average nursing home resident was tied down. We had a nursing home in Washington, D.C. with more than half of our residents having stage 3 and 4 pressure ulcers, mostly from being tied to bed. We have come a long way. There's still a lot to do. Yeah. But we could lose it all when we double the number of people needing help without any way to pay for it and without any vision of how we're going to do it. So more than anything else, I'd call on you to shed any reticence about talking out, about talking to your newspapers, about talking to your representatives, shed any reticence, make mistakes. I don't care, make mistakes, but push people to notice that this is our last good chance to make a difference in how long-term care will happen within the next decade. And if we don't do that, we are going to just see enormous suffering, lives foreshortened. And it's us. I mean, the one big advantage we have is that no one can count themselves out. This isn't like, you know, oh, the poor starving children in Africa where you can know you aren't one. It is us. This is our futures, our kids' futures, our grandkids' futures. So let's all line up to really push the agenda.
Well, Joanne, as always, your impassioned delivery of substance is certainly felt on this call and known. This is not new news to you by any stretch of the imagination, but the fact that you have so succinctly put this whole package together. I just want to offer one point to amplify your comment about the middle income. One thing that I don't know if people stood back and realized, the degree of homelessness that we have right now is really speeding up, and nearly half the newly homeless in most urban areas are people who are middle income, older individuals, people over 50, that comprise nearly half of the newly homeless. And so what Joanne is raising now is talking about this epidemic that we already have, that many people don't see with a lens of clarity that Joanne has pointed out. So again, the compelling aspect of this growing epidemic that we have, a chronic epidemic that has just now further embellished. So Joanne, thank you for giving that perspective. I'd like to move over to Alex, if you can add further on to the comments that you had earlier.
Sure. And I think also bringing up the middle income piece is a great connection too, because when you talk about long-term planning for this kind of thing and funding and making sure that we have a safety net for people, and even people who think they probably don't need a safety net, but they very well may with the cost of care in this country. I think having a conversation and going back to what Bob said too about building a real system, having an actual system, I think one of the talking points that I find surprises everyone when I tell them this outside of this world is that, Medicaid is the number one payer for nursing home services by far. And a lot of people just don't understand this. A lot of people don't know that that's what that is. And I think that's a symptom of us never having a real long-term care system. What Medicaid was never meant to be a long-term care program. And I think even that level of education, bringing that up in your conversations and talking to your lawmakers about that, Medicaid is an extremely contentious issue in a lot of states. It's a welfare thing for a lot of people. People think of it as welfare. That's a very politically radioactive topic. It's pretty easy to kind of point to Medicaid spending as something to cut. I think a lot of lawmakers don't realize how much, people of all economic classes, and I'm not defending this idea that poor people deserve less medicine. I mean, they deserve everything, that we live in the richest country in the world. Everyone should have access to this kind of thing. But I'm just saying that politically, it's very easy to sort of think that, okay, we can cut Medicaid. It's not that important. It's not this comprehensive program. It is. It affects so many more people than we sort of generally imagine with Medicaid. And I think that's a huge stumbling block for a lot of reasons. One, because it is so politically radioactive. Two, because every state is different. With Medicaid, it's very difficult to, create a whole new system off, from scratch because you're dealing with 50 state Medicaid programs. And, again, it was never designed to do what it was supposed to do, what we expect it to do now, rather. And so I think that's a huge opportunity to, first of all, when you're having conversations with lawmakers, with policymakers, to emphasize that up front. Anyone on this call, anyone outside of the extremely, extremely wealthy may one day end up relying on Medicaid for long-term services and supports. And that's a big issue. So I think the more people who understood that, the more of a sort of productive conversation we could have on this. And then again, I think also breaking through that sort of binary that I mentioned earlier, I think transparency is a huge issue that I think I do encourage everyone in the sector to get behind. I think we lose so much ground arguing over, well, our Medicaid rate's enough in this state, our Medicaid rate's enough in that state. And frankly, we don't know in a lot of cases because, nursing home finances have historically been so opaque. And so I think, I know we might get to this a little bit later, but I think in terms of what are some of the bills on a higher level or some of the legislation on a higher level that's really working toward improvement, I think transparency legislation in a lot of states is really important because it can help us have a more open conversation and make it be less about us versus them, different sides within nursing home long-term care reform versus others, and more so in terms of what are we spending now? What will it cost to create a better system? And how can we build those funding systems to make sure that we can get the system we want, no one's taking advantage of it, and all the money is really going to the people who will benefit from those services. So I think that's a big piece too, as we talk about sort of big picture conversations and dialogue changes.
Well, thanks, Alex, for raising this. Your comments coincide with Gary Epstein-LeBeau to us about legislation. And again, there's a long road to this. And Joanne, I know you answered it quite directly, but I wonder if you just might give a context of what's been called the WISH Act that you had a chance to work on when you were working as a fellow for a congressman.
Yeah. I had come to the conclusion that even if this was early in the Biden administration when it looked like we might actually get funding for such remarkable things as a fair wage for nursing home aides, that all of what we achieved or what we could achieve was going to fade when the numbers doubled if we didn't have some better way of providing the financing. And that the one critical element is that a diligent and thoughtful middle income person in middle age cannot have protected themselves from the cost of long-term care in the way we now have things arranged, because long-term care insurance is both very expensive and somewhat underwritten, and by the time you're 50, you often can't qualify. But in addition, it is capped. So at best, you can buy enough for maybe a year or two of facility-based or extensive home-based care at best. So lots of people who come to understand that sort of throw up their hands and say, I'm just going to take my chances because this is like buying insurance for the kitchen fire and not the house fire. I mean, yes, I'm concerned about the first year or two of needing long-term care, but what really would be devastating to me and my family is to have 7 or 10 years. And that's quite possible. 1 in 7 of us will have more than 5 years of needing care at the level of 2 or more ADLs or cognitive failure requiring constant attendance. That's the trigger for long-term care insurance. And more than 5 years, almost no one can save for that. So we needed a way to get financing that would make more sense. Now, the script for the boomers may largely have been written. I mean, we boomers are going to end up needing charity because we didn't save enough, we didn't insure enough. And we're going to live a long time and then have an average of more than 2 years of needing long-term care. But the next generations would not have to live under that burden. The next generations could have a system in which the serious catastrophic risks are covered. One, it could be out of a wage tax, which is how we wrote the WISH Act, could be out of another financing scheme. But to have a catastrophic long-term care insurance is a key part of having a way in which the middle class can protect themselves financially. And if we put that in place, then our grandchildren, people who are 20 now or 10 to 30, right now face what one person has called a triple mortgage. They have enormous student debt. They have trying to buy a house, and they have the care of their parents and grandparents. And that is way too big a burden. And it just keeps expanding unless we step in to do something about it. So that's the reason for the WISH Act. It is complicated. The definition of catastrophe is different depending on your lifetime opportunities to save. So the average person would wait 1 year, 10 months before the WISH Act would kick in. It doesn't cover everything. It's written to cover $3,600 a month, which is enough for most home care and a substantial contribution to nursing home care, but it wouldn't cover nursing home care. You would still spend down. But obviously all the pieces of it could be changed around, but the fact that you can't tell today whether you are someone who will have a few months of serious disability or 10 years of disability makes this a prime candidate for insurance. And the insurance pools have to be large and they have to cross state boundaries because people move around. They have to cross employer boundaries because people change employers. So a federal catastrophic long-term care insurance just makes such good sense. And we wrote it up as the WISH Act. Lots of the small points could be changed. You don't have to support the WISH Act per se. But boy, catastrophic long-term care insurance is a winner of an idea. And if we don't do it now, the cost will be more and we'll be relying upon public charity.
Thank you, Joanne, for such a pithy summary of our the WISH Act and all the elements that go through it. In our notes here in the chat, another more specific act is being proposed called the Essential Caregivers Act, and I understand there are some experts in our Zoom call today. And what Joanne has done is laid out the comprehensiveness of this in terms of a specific and more immediate piece on our journey toward this, the brass ring. I wonder if one of you would like to talk a little bit more about that, the essential caregivers legislation that's moving.
I guess I'll jump in, but I would invite some of my colleagues, and I know there are some very well-versed ones on this call. The Essential Caregiver Act was introduced in June of 21. And it is known as, the number is HB 3777. You can look up the act through that number, HB 3733. But it's in the process of being reintroduced into the 118th Congress. It was introduced by Claudia Tenney and co-signed by John Larson out of Connecticut. There were 81 co-signatures on this bill, and I'm sitting, I know as my colleagues are here today, up straight about strategies, because none of us were politically astute. We thought this was, a bipartisan or nonpartisan, no fiscal note, act that would have sailed through, and we found out that wasn't the case in the 117th. So we're now sitting on the edge of our seats waiting for it to be reintroduced. There's some very, very significant work being done daily. We're working with Ways and Means. We're working with Energy and Commerce. There's not a day that doesn't go by, Monday through Friday, and we're hopeful for this Congress that it gets through. For those of you who don't know what the Essential Caregiver Act is, it's a response to the isolation that was devastating during COVID. It ensures that every person in long-term care has two people who can be their essential support person, and they would be under the same infection control protocols as staff, but only assigned to that one person. My mom was a person who lived in a nursing home for 4 years. She had the very good fortune of having her family by her and an essential support person that the family hired because we couldn't give her the care that she needed. And then March 2020 came along, and she lost everything. She was on her own for the last 8 months. I tell you this story, it's devastating to our family, but she went from a very well-cared individual to a person who was abandoned. And there are thousands of stories like that through the country, and that was the motivation for the Essential Caregiver Act. I invite any one of my colleagues to jump in and pick up where I've maybe left some holes, but that's essentially what it is. The fact that there's no fiscal note, the fact that we've had this much difficulty getting through, we were warned by people who were much more astute than us that things don't happen in 1 year, and we were naive, but we're still at it. So we're now looking at a Senate companion bill as well, but I'm not able to talk about that at this point in time.
Sure.
Thank
Liz,
you, Liz.
Thank you for giving us that backdrop, and we'd love to hear from others. Just as a context, some of you may be aware that I was connected to moving the PACE legislation, the program of all-inclusive care for elderly, and it took me 3 congressional sessions to kind of get this going. And to your point, there are so many ins and outs. I know Bob would be able to kind of count the litany of processes that get involved in, and the context of the times is just so key. So I know that some of you will be surprised to know that the PACE Act was passed 25 years ago. So even when you get something passed, the ability to really get the execution and the uptake and the proliferation is a whole nother effort. So back to just Joanne's point of we should have started yesterday, obviously. But bottom line is we start where we are, and we just anticipate the framework that we have to work with and the different political contexts. Before we go back to the Essential Caregiver Act, I wanted to ask Bob Blancato. Bob, given the conversation in Congress now about cutting Medicare itself and talking about Social Security, some of your reactions to the proposal for this particular act, as well as the excellent background that Joanne gave us on the WISH Act. So a political, perhaps, perspective from your point.
Yeah. Well, first of all, Liz, I'm very familiar with the Essential Caregivers Act. Spoke to a lot of your friends in Connecticut about it. Thought it was a smart approach to take. Joanne and I have talked a lot about the WISH Act. You know, you talked about the pace taking a long time. Some of you are familiar with the Elder Justice Act, which I was involved in. It took 7 years for it to pass, and then another 5 or 6 years to get it funded properly. And so I think the answer here is, first of all, I think there needs to be some combination, a blending of the Essential Caregivers Act and the WISH Act, because there's caregivers involved. And caregivers are represented constituency that is undertapped from a political perspective, needs to be more engaged, because they, you know, there's two things that drive the legislative process still, okay? Up-to-date data and stories, okay? Human stories, okay? And I think because you've got any number of those that are in there, and the other part that's important to remember is you got to be incremental. Even though you may say, I want the sun, the moon, and the stars, that's not going to happen. You know, start with the sun and then move your way up, right? And have a catastrophic plan. That is a smart way to start, okay? That's not the entire picture, but you need to start somewhere. The Essential Caregivers Act is very specific in what it calls for, okay? It's not giant, okay? So being incremental, I think, is very important. But I think also it's very important to have hearings. Okay, because hearings are an opportunity to spotlight the issue, okay? And, you know, making sure that, you know, these hearings are well publicized, social media. I mean, if we get the number of people on this chat alone, imagine if you had a congressional hearing where you had people coming in and talking about things and people adding their thoughts to it, you could start a movement just in response to a hearing with the right witnesses there, okay? So to me, from Liz's standpoint, you know, John Larson is still a very significant player in the Ways and Means Committee. They've got new leadership there, but push to get a hearing, get this thing on the point where it's moving. That's the first step toward movement. And on the, you know, on the WISH Act, you know, let's get it reintroduced and let's promote it very aggressively at the time it's introduced, so more people know about it. Okay, this shouldn't be buried in some, you know, legislative digest. It should be in everybody's local newspaper. Hometown newspaper, because don't forget, that's still important to a lot of elected people. They read about something, if they're associated with it, and they get a letter of commendation for being a co-sponsor of either the Essential Caregivers Act or the WISH Act, they're going to read about that, okay? So little elementary things like that are important, but I see hands are up, and I want to make sure I don't take up too much time here on that question, Jenny.
Okay, thank you. We'll get back to you. There's a question for you about a hearing, but let me move back to Dan, who's had his hand up patiently. Dan?
Thanks, Jenny. You know, I agree with what everything's been said, but I really agree with what Alex said, like from the very beginning, because it's somewhat intimidating to me to talk to such a group of, I mean, Joanne, I'll argue with almost any time, right? I'll debate you, Joanne. But you know, it's intimidating. But the question that Alex asked is how do you affect change? Okay, and if I could just, if it's okay, can I give you some of my takes on it, because I've been really involved with this, and I'm going to be way more granular. All right, now I think Joanne has been so far ahead of the curve. You know, the issue is a lot of ways is how you make people understand the importance of advocacy. Just the very beginning of it, okay? Now, for those of you who don't know me, I'm a geriatrician and a medical director. And the thing is that I think what we're trying to do at AMDA is make physicians realize, and I think physicians, and I don't think this is fair, but I think physicians can have an oversized importance when they talk to legislators. I think it's the novelty of physicians talking to legislators, because, you know, they've never really done that. But I think if you can get physicians to understand this, and they go, instead of like say, you know, what's in it for me, to politicians, and start saying, I'm a subject matter expert. I mean, all the stuff we've talked about is super important. Now, Alice, I happen to be giving a talk at AMDA on having AMDA affiliates have public policy committees, and we're probably giving a talk at the same time, because that's how it always works. But if you're able to show up, that would be great. But think about it, right? It's like if you can get people who understand it. Now, I've actually been meeting with my congressman weekly, his staff weekly, which I can guarantee you most doctors haven't been doing since COVID started. It's how you develop the relationship is the first part, okay? Now, it just so happens that my congressman was just named to Ways and Means, which is terrific, right? So me, who's from Pennsylvania, both of my senators are on the Senate Aging Committee. So how do you have to have the relationship first. And it's what Bob said. You can't ask for the moon and the stars. But some of the stuff that goes on, you wouldn't even imagine. Like I do this and that. And Irma Rappaport got in touch with me about getting in touch with my congressman about the Essential Caregivers Act, right? So then I go to AMDA and I say, hey guys, in the Public Policy Committee, shouldn't AMDA support the Essential Caregivers Act, right? Because geriatricians and medical directors tend to be collaborative. And you know what the response is? Hey, that's a good idea. Well, of course it's a good idea, but why did I have to bring it up to AMDA? It's like there's such opportunity to develop this relationships between organizations. Now, with the House bill that AMDA is interested in, which again, my congressman co-sponsored, was the Nursing Home Transparency Act. That is House Bill 177, right? So this is something which is such an easy ask because, Bob, it's what you said. If you don't have a relationship, not only can you not ask for the sun, moon, and stars, you can't ask for the sun. You can't ask for anything because you don't have a relationship. So talking to organizations, I know what everybody does. They said, write a letter, and they do a letter campaign, right? But really getting people to understand this, to go meet with their representatives, to even know who their representatives are, that's the first step. So I'm talking to AMDA. I'm like, let's talk about this at meetings. Let's have a QR code where they can link on and give a step-by-step thing for an easy ask, to start this process. I think there's a lot to do. I think we all realize, so when House Bill 177 got introduced, it's to your point, Jenny, I'm like, wow, this is great. It's a 200-word bill, which for those of you unfamiliar, it basically says, make the name of the medical director, develop a registry. It's like the easiest thing. So I'm like, wow, let's do it right away. And they say, no, Dan, that's not how this works. Give it 3 years, So yeah. That's how these things work. So we also have to make people realize it's the long game. Anyway, I'm sorry to yak, but you understand it's developing the relationships, I think. Sorry.
Thanks, Jan. I think that's underscored.
But let's not set the threshold too high, Dan. Everybody on here, with or without a relationship, can write to your senators and congressmen and simply push the idea.
Sure.
And if, we have 58 people, if everybody asked one friend, we had 100, that would be enough to start making it an issue. And whenever you have a chance to talk to a press person, a media person, tell them, what story do you want to write? How can I help you? If we can get to pollsters, let's start polling on how worried people are about the obligations involved in caregiving. You don't have to be a pro, and you don't have to have spent a tremendous amount of time. If everybody here spent an hour a month dealing with this issue with your representatives, it would make a difference, because no one's doing it now. We come at them with a very narrow thing, which is important. I agree with Bob, you got to be incremental, but you do also have to have them realize that we are facing a major increase in the number of people who do not have the funding to support themselves when disabled in old age. We are going to have huge numbers of people unhoused, without food, unless we do something now. And there's a variety of somethings. I mean, I'm committed to the catastrophic long-term care insurance, but I know it won't help the people who are already 85 and retired. Right. So there are other things need done. Yes. So anyway, don't set the bar too high. Do something you didn't do last month, and each month do something you didn't do the month before, and we will have made a movement.
Well, Joanne, I think you've listed a playbook about our different points of entry into this. Those of us who have had family members, loved ones who've had the need and have the need, to thinking about your professional organizations that we're a part of right now. And so I'm hoping, Alice, that perhaps a broad, outline playbook of start where you are with the kinds of experiences, and then know there is, as pointed out, the big picture of catastrophic, of people who are in their 20s today. But how can we mitigate the unhoused circumstance that so many older people are beginning to face and have faced even now? So there are links in the materials that are in the chat now, and I think that Isaac will have a summary note that will add some of these links that we've discussed in the course of this call. And but the ability to get the diverse opinions that we have, from mega to very specific with our local politicians as well. And something struck me, Alice, in the course of everybody's bringing up different ways to do this. I wonder if AARP, which used to have a set of questions for elected officials at every election time that related to the whole area of aging, and then specifically long-term care. I wonder if they can be brought in again as part of the team to elevate this, especially knowing what's coming out of as products from the Moving Forward Coalition. And so that we, again, gather our troops in a way that is focused, targeted, and continuous, whether it's at the family level, or whether if it is somebody like Dan, who's a leader in a medical and organization on long-term care. So Alice, I'd love to just kind of turn it back to you as we begin to wrap up this call.
Sure, happy to, and thanks so much, everybody. This is one of our most interactive calls, no surprise, given our fantastic speakers and panelists. Regarding AARP, we've had multiple conversations with them, both at the state level, with a number of individual states, and at the federal level. They are very interested. They want to partner with us. They're open to ideas. And your point that you raised is a really good one about those questions for legislators. That might be one of the best ways that we can actually work with them. So I think we will circle back. Related to that, just want to let everybody know that Isaac and Erica and our team have been working really hard with individual organizations who would like to be listed as supporting organizations on our website. So we have close to 30 now that said we want to be listed with our logos. So in the next month or so, you'll see them, to be listed there. So it may not be AARP, but it might be, American Geriatric Society, or, any number of other organizations, and others that we are all part of. So those are still, being developed. But just, any other comments would be really helpful before Jenny wraps up. But I see Karen chatted in that there's a new long-term care aging caucus in Congress. I don't know if anybody else is familiar with that, but Karen, do you want to say
Alice,
anything?
I am. I've been asking my congressman about it, and it's like in development. I think part of it was through, I'm not sure if Argentum did this, I believe it's provider based. And you know how caucuses work. It's more or less, I mean, you guys probably know better than I do. To some degree, it's like an extended email chain. It depends on how developed the caucus is. So that's still, I believe the last one was like 10 or so, but it's certainly an opportunity. I think it's a to be developed caucus. Anybody else know anything about it, or was that right?
I reached out to the health person that works with Representative Custer, and they have about 10 members so far at least, and they're looking for more members. So I know there's a couple in my state, so I was going to reach out to them. That's as far as I've got with that, but it's called the 21st Century Long-Term Care Caucus. So
great. Karen, thanks for giving us that amount of detail. And Isaac, maybe this is one of those follow-up areas that can spring from this particular call, just so that this group is that much more informed and, frankly, perhaps can get some of their Congress people to be aware of it, if not, join it. And well, this has been a hugely dynamic call of input exchange and next chapter work. No surprise, there's next chapter work, but I really want to thank Isaac and Alice for helping us come together in this way to open up the dialogue to a much more variegated audience that we have today, in addition to some of the more technical calls that come with the part of the Moving Forward Coalition. So with that, Alice and Isaac, if there's something that you'd like to say. I do know that Bob Blancato did answer a call about how does a hearing get called. So perhaps we can make that a part of our summary notes and make sure that people have that in terms of how one pulls together a hearing. And I'm going to turn this completely back over to you, Alice.
Well, Isaac, do you have anything that you want to say in wrapping up here?
Just thank you to Jenny, Joanne, Alex, and Bob for taking the time today, and for all of you for joining us. I put our info email in the chat. If you have more information that you want to share with the group about some of these issues that come to mind, please send it along to us, and I'll pull it together in a summary email. And just so grateful to have this whole group as thinking companions. It's a real pleasure to learn from you all.
Yeah, and I'll just echo all of that and say, behind the scenes, there's just an absolute, slew of emails that come into Isaac largely, and Erica and myself every week, and we are doing our best. But this kind of conversation is what we're trying to continue to have. And so, Joanne Lynn chatted in, raise your voice. That's probably the best thing for us to end on. Raise your voice, raise our voice, because no one is going to fight us for this. This is a role that we want to pick up and run with, and we want to build on all the great work your organizations are doing. So I'm going to ask, is this a useful conversation for us to schedule again? Like, we could schedule this again in 3 months, and I see a lot of thumbs going up. So I think to continue, and again, kudos to Joanne and others who, really, thought about doing it this way. But I think we can really have a productive conversation, and we have to move it forward, as we say, because, how can we get to talking about it? If 115 people signed up for this call, would 50 of them write letters to their senators or Congress people? I think they probably would. So we have to move into that action phase, and we're really ready to do that now. So thank you. Thanks to Jenny for moderating, and all of our great panelists. And everybody, go forth, raise your voice, and we'll keep going from here.
Thank you.
Thank you.
Thank you.
Thanks so much. Thank you, folks. Well, Dad. Let's see.
Is your dad still with us?
Yeah, he's like, hi, Alice. Yeah, you with us, Dad? He's a good listener.
Yeah, I guess so. Thanks for speaking
He's a
up.
good listener. Yeah, I had no idea that was, what the scope was. I signed up for this such a long time ago, and it just popped up, and had to jump in here today. And I'm so glad. Thank you so much, guys.
That's great. Thanks for being on. Well, I still plan to come down to Connecticut at some point, so I will. Anyway,
you got a place to stay. Bye-bye.
Bye, Liz.
Bye.
Isaac, are we good? Are you good?
I got to get off.
Yep, I'm going to stop the